What's up, Camps fam? Thanks for coming back to the channel. But before I go any further, please always talk to your doctor before you make any decisions. I'm just speaking from experience and from all the facts and the things that I have. So let's dive right in. Here's some seizure medication tips. 1, seizure medication should always be taken as prescribed. If you ever just stop taking it or even try to lower it, there is a chance you can have a seizure or aura. I can tell you right now, if I stop taking my seizure medication cold turkey, I only can last 48 hours before I have a seizure. 2, use of any other medications or vitamins should be discussed with your doctor or pharmacist. Absolutely. Always talk to your doctor. Don't just go off of what I'm saying. Don't go off of YouTube, family members. Always talk to your doctor and have a plan put together. 3, don't change from brand name drug to a generic drug without first talking to your doctor. And then 4, keep a 1 to 2 week supply of seizure medication to avoid running out. I always have my pill container filled up for the whole week so that I know when I'm getting low. And normally I go to CVS, that's just where I get my medication from. And when I know when I'm kind of running low and how far I can go. Like if today's Monday, I fill up my week to next Saturday and my container, my actual bottle runs out, I know, oh, I need to get on the phone with CVS if they already haven't called me to come get my medication. So just keep that in mind. Here's some seizure triggers, and these are the most common ones. There's definitely more. Forgetting to take your medication, lack of sleep, missing meals, stress, excitement, or emotional upset, menstrual cycle or hormone changes, illness or fevers, low seizure medication levels. So even not just forgetting to take it, like even just taking less than what you should be taking with your medication. Medications other than prescribed seizure medication. Flickering lights of computers, television, videos. Those are really just people with photosensitivity, like the people that are effective with lights. It actually says photosensitive epilepsy. I didn't know that was actually the name for it, but I'm glad I just saw that, so now I can actually say that, which is amazing. So excessive alcohol consumption or withdrawal. And then last but not least, street drugs, cocaine, ecstasy, LSD. Good enough. Recording your seizures. You should always actually keep a record of your seizures. It's very useful. You know, like the days you have them, how long they lasted, so that when you do go see your doctor, you can tell him about it. He can, you know, make a log of it, and then you can make the best plan of action for your next change or your next medication. So I just keep a little notepad on my phone, the date, when it was, how I was feeling, stuff like that. It says, before a seizure, what was the person doing? Were there any provoking factors like lack of sleep, flickering lights, alcohol abuse, missed medication, missed meals, etc.? And then did the person experience symptoms before or after the seizure occurred? During the seizure, how did the seizure begin? Did the person experience an aura? Was the person responsive during the seizure? Was the person experience daydreaming? Did the person stare blankly? Did the person experience lip smacking or chewing movements? That always happens with me. I always bite my tongue. One time when I was at my work, I think a lot of my peers, they thought that you could swallow your tongue during a seizure. That cannot happen. So they were trying to help me and they were putting things in my mouth. Do not put things in people's mouth when they're having a seizure. It hurts the situation. Did the person's eyelids flutter or eyes roll? Did the person's body become rigid? Did the person cry out or yell? Did the person's skin change color? Did the person's breathing change? Did the person fall? Did the person bite his or her tongue or lip? And did the person lose bowel or bladder control? And then after the seizure, did the person experience temporary weakness in the body, fatigue, confusion or headache? How long did the period last? Was there an injury as a result of the seizure? Here's what to do if someone is having a non-convulsion seizure. 1, stay with the person. Let the seizure take its course. Speak calmly and explain to others what is happening. 2, move dangerous objects away so they, cannot hit their head or hit anything around, like coffee tables, furniture, things of that nature. 3, do not restrain the person. Again, in the video I shared earlier, I'll put it again here. That's one thing the police officers did, is they actually hog-tied me. It was probably the worst thing they could have done at the time. 4, gently guide the person away from danger or block access to hazards. And then 5, after the seizure, Talk reassuringly to the person. Stay with the person until complete awareness returns. And then normally that person is fine, right? What to do if the person has a convulsion seizure? So these are normally the big ones that I have. 1, stay calm, let the seizure take its course. 2, time the seizure. That's one thing a lot of people forget to do because it's kind of hectic, right? But if you see someone go into a big seizure, hit your stopwatch or look at what time it is. And I'll get to why in a minute. 3, protect from injury. If necessary, ease the person to the floor. Move hard or sharp objects away. Place something soft under the head, like a pillow if you have it. I mean, obviously you might be out and about, so just try to help the person to the floor if you can. 4, loosen anything tight around the neck. You can even check for medical ID or like a necklace, or mine is actually, if on the iPhone, there's actually if you just hold down on both sides, it actually shows call 911 or medical ID, and I have my medical information right there. So 5, do not restrain the person. Again, worst thing you could do. 6, do not put anything in the mouth. Please don't do that. The person will not swallow his or her tongue. 7, gently roll the person onto his or her side as the seizure is happening. So it's like you can't choke on the saliva. And then 8, after the seizure, talk to the person reassuringly. Do not leave the person until the awareness is back. The person may need to rest or sleep. That's a big one. I want to get back to why you time it. This is the only time you'd really call 911 or an ambulance. If the convulsion seizure lasts longer than 5 minutes, that's when you would call an ambulance. If the consciousness or regular breathing does not return after the seizure has ended. So if they're done with their seizure and they're still breathing really weird and it just stays like that and it doesn't seem normal to you, you should call an ambulance. If seizure repeats without full recovery between seizures, they just keep having seizures, you should probably call someone. If the confusion after seizures persists for longer than 1 hour, they're still confused, call somebody. If a seizure occurs in water, or there's a chance that the person has inhaled water, because like if water actually gets in the lung, it can actually cause like some lung damage, and that's actually a really bad thing, so you should actually call someone as well. So, and then last but not least, if this is the first time that the person is having a seizure, if they're pregnant, or if they have diabetes, you might want to call somebody because they might have extremely high or low blood sugar levels at this time. So call somebody. And this is actually everything with the guide for professionals and caregivers with epilepsy. If you actually want to see any of these books yourself, you can actually go to www.epilepsymatters.com, or you can call 1-866-EPILEPSY. I'm actually going to cover all my other ones in previous videos, and I'll see you next time, guys. Subscribe, like this video. Later.